Hi, I'm Calvin Lee. I'm a physician assistant with Regenerative Ortho Sports Medicine, and I'm here to talk a little bit about the elbow. Elbow injuries are fairly common, especially through repetitive motion injuries. In particular, kind of like repetitive motions where you're going backwards or forwards with the elbow, similar to like tennis movements, golfing movements. That's where tennis elbow and golfer's elbow comes from. In terms of treatments and things that we can do for the elbow, we diagnose this with ultrasound in the office, so we can see the actual injury, pinpoint where the injuries are, and there's multiple options in terms of treatments. One of the things that we can do is shockwave therapy, so very similar to what you would experience when you go have kidney stones, where we send strong sound waves to that particular area. And those sound waves causes little micro injuries to the area that don't necessarily increase pain or destabilize the area, but causes more blood flow and creation of new blood vessels, and that allows more healing factors to hit that area. The short term for it is EPAT, and stands for extracorporeal pulse activation therapy. A step up from that would also be prolotherapy, where it's a dextrose injection. So when you have an injury, you go through this inflammatory process, and inflammation then draws plates and growth factors to the area. Plates and growth factors then draw stem cells for healing, and that you go through that rapid phase of inflammation and healing over a 4 to 6 week time frame. A lot of the regenerative treatments that we do is designed to kind of reinitiate that inflammatory healing process. So the prolotherapy, short for prolific therapy, is actually a numbing agent mixed in with dextrose, and the dextrose is an inflammatory chemical. So we inject it into one particular injured site, which we can see on the ultrasound, and target that specific injury site, creates targeted inflammation to that one particular area. And when that occurs, it fools the body into thinking that there's a new injury. You go through that inflammatory process, draws plates and growth factors in the area. Those plates and growth factors can draw stem cells, which creates the healing. And just like a new injury, you go through that rapid phase of healing over a 4 to 6 week time frame. With that prolotherapy, we usually go through anywhere from 1 to 4 sessions for that. A step up from that, if you're not responding to the prolotherapy, would be PRP, platelets rich in plasma, where we draw your blood, we spin it, we centrifuge it, and we separate the red blood cell waste from the plasma. The plasma becomes much more concentrated. And in that plasma concentration, you have 5 to 10 times more plates and growth factors compared to regular blood flow. So when we inject it back into the injury site, it draws even more stem cells compared to prolotherapy or to regular injury. You get a more inflammatory process, and you get greater healing. The PRP is equivalent to 2 to 3 prolotherapy treatments. And then usually above that would be cellular treatments involving bone marrow or fatty tissue that has a lot of stem cells, where we draw the fatty tissue from your flank or lower back and the bone marrow from your pelvis. We purify it, break it into smaller pieces, concentrate it, and we inject it back into the injury site. So if you think about with very similar to like foam insulation on the home, if you have a crack in the home and you spray the foam insulation to the area, that foam insulation spreads and fills that entire space. And the same thing with the fatty material or with the bone marrow. It fills in that space, holds the stem cells in place, and the stem cells then convert that fatty tissue or bone marrow tissue into the tissue that we want to convert to at the injury site. So that fatty tissue or bone marrow actually creates a scaffold for the stem cells to really work from. If you don't fix the injury site after a period of time, it can lead to greater tears, greater inflammation, and actually causes compensatory patterns that can actually cause injuries elsewhere too. So if your elbow's not working properly, things downstream like your wrists, your fingers, and things like that have to work that much harder. A good comparison would be if you're doing a tug of war. If you can't plant your feet, your entire upper body has to work that much harder to compensate for the instability at your feet. And the same thing here. If your elbow's not working properly, your wrists, your fingers, and everything have to work that much harder to compensate for the injury at the elbow.